my name is Serena. I'm one of the technicians here at Saddleback Eye Center. And first and foremost, congratulations on finishing your PRK procedure. There are a lot of steps to ensure that you get your best vision possible after the surgery, so I'm here to go over with you how to take care of your eyes to ensure that they heal properly. Now, before we get started, I wanted to remind you that PRK is a different procedure than LASIK. They will get you the same visual results at the very end of your healing, but PRK will take a little bit longer to heal than a LASIK procedure would. So be patient with your return of the vision. During the first week or so, you might notice some visual fluctuations. You might notice some light sensitivity. That is all normal. You may even feel some discomfort in your eyes after surgery. You might notice that your eyes are tearing up a lot, or maybe there's some soreness or some minor swelling around your eyelid region. And again, that is all very normal to experience for about a week or so after your procedure. The first step of taking care of your eyes is to make sure that you're not touching, you're not rubbing, and you're not squeezing your eyes together. We have what we call a 1-inch no touch zone, which means that any of that soft tissue around your eye, usually within 1 inch of your eye, you want to avoid touching that. And again, no touching that area, no rubbing, no squeezing. If you do need to touch around your eye, you can touch outside the bones of your eyes. So from the bone and out, you can touch, but anywhere within that area, you cannot touch that for the first week after surgery. So there is a contact lens that we put into your eye to help keep it moist, to help keep it comfortable, to almost act as a band-aid in the healing process. If you touch, rub, or squeeze your eyes together, that contact lens can come out. It will be a little bit more uncomfortable, but if the contact lens does come out, you can always give our office a call and we will let you know if we need to put in a new one or not. So, getting started on your aftercare instructions, you're going to be receiving 2 different bags today. You're going to receive this little black bag, and then you will also receive this big purple bag as well. Both bags you need to bring back with you to your post-op appointment, and make sure that you bring back everything inside of the bags with you as well. So inside of your little black bag, you're going to see a few things. The first one is going to be a few sheets of paper that are folded up like this. This yellow one on the front is going to be the key points in how to take care of your eyes after surgery. And then the white ones behind it are going to be some more handouts with additional information and a more depth explanation of how to take care of your eyes if you would like to read through it as well after you get home. There's also a bag of Motrin here. This Motrin can be taken as needed for the discomfort that you might feel during that first week of healing. There is an additional Motrin in the very front pocket of the black bag. And then there is also a acetaminophen tablet, also known as Tylenol, to take for discomfort if needed. Well, let's talk about eye protection. Now, you need to have your eyes protected 24 hours a day until we take out that contact lens, which could be up to 2 weeks. You are going to go home with the goggles that you got after surgery. And these goggles, when you put them on, you want to be very careful because these do point inward. So whenever you put them on, you want to pull the legs as far apart away from each other as possible and then slide them on. Now, since you do have to wear eye protection for 24 hours a day, you will have to wear these while sleeping. There is some tape to help secure the goggles at nighttime, and each strip will go from your temple down to your jawline, right over the sides of the legs of the goggles. That way it can help keep them secure at nighttime and make sure that it doesn't fall off while you're sleeping. And there is also a little handout here to help visualize how to tape your goggles if needed. Now, when you take off the goggles, you need to be very careful. You don't want to just pull them off the very front because, again, those legs do point inward and will poke your eyes if you're not careful. So in order to take off the goggles, you always want to use 2 hands, pull them up to the top of your head and then straight off the top. And that will help prevent these from getting anywhere near your eyes and poking them. If you are walking around during the daytime and you don't want to wear these goggles, we are giving you a pair of clear glasses here. These glasses have no prescription in either lens. They are just for eye protection during the daytime if you don't want to be wearing your goggles. And again, your goggles do need to stay on at nighttime while you're sleeping. If you are out and about in the sunlight, you want to make sure you're wearing polarized sunglasses instead. That will help protect your eyes from the UV rays and delay cataracts later on in the future. It's time to discuss the eye drops that you'll be using. So you'll be using 3 different eye drops total, and all 3 of them do need to start today on your day of surgery. So you have 2 medicated eye drops and you have 1 over-the-counter lubrication eye drop. So we'll start with your medicated eye drops. You have an antibiotic, which is your moxifloxacin, and then you have an anti-inflammatory, which is your prednisolone. So your antibiotic eye drop, you're going to be using this 4 times today on your day of surgery, and then you want to do it 1 time before you come in for your post-op appointment. Your anti-inflammatory, your prednisolone, you will be doing this 4 times a day, every day, until we take out that contact lens, which again could be up to 2 weeks. So again, this one is 4 times a day, every day, until we take out that contact lens. And for this drop specifically, you want to make sure that the medication is distributed evenly throughout the bottle before you use it. So make sure you give it a good shake before you put the eye drops in. And it is a milky kind of consistency and color. So when you put the eye drop in, you might notice that the vision fogs up for a little bit for probably a few minutes, and that is normal. Now, for both of your medicated eye drops, you will only be applying these into the eye that you had surgery in. Whereas your lubrication, you will be using it in both eyes, or whether you had surgery in the eye or not. So for your lubrication, in order to use these little vials, you're going to tear one off. You twist the top and pull it off, and then you put the eye drop into both eyes, and you can actually seal the top by snapping the cap back on. That way you can use up an entire vial before you open a brand new one. Now, for your lubrication, these ones are just as important as your medicated eye drops, so please use them diligently. And today you're going to be using these every hour, and starting tomorrow, as soon as you wake up, you'll be using these little ones every 30 minutes for 30 days. Again, every 30 minutes for 30 days, because dry eyes will delay your healing. Now, whenever you're putting in eye drops, you want to keep the tip of the vial or the tip of the bottle at least 1 inch away from your eye when you use it, and that's to prevent any kind of contamination. And whenever you put the drops in, you want to try and aim for your inner corners of your eyes, and that way it'll be less likely that you'll miss. Now, if you need to take 2 different types of eye drops at the same exact time, they're scheduled for maybe 7 o'clock in the morning, you can take one, close your eyes for 30 seconds, and then you want to wait about 15 minutes before you apply the second eye drop. And those 15 minutes will allow the first eye drop to fully absorb into your eye, so the second one won't wash it out, it won't dilute it, and you get the full potency of the medication. So again, make sure you wait at least 15 minutes in between each type of eye drop, and it doesn't matter which one you start with, you just need to wait in between each type. For all 3 of your eye drops, you will only need to take them during waking hours. So that means when you go to bed for the night, you don't need to wake up to put your antibiotic in. You don't need to wake up every 30 minutes to put your lubrication in. Just finish your eye drops when you go to bed, and then when you wake up the next morning, you can continue using your eye drops as scheduled. You will also be taking an oral medication called doxycycline, and it is a pill that will help prevent your eyes from drying out too much during your healing process. So we will get that pill for you, and you will be taking it twice a day for the next 30 days. And please, please, please make sure to take the pill with food. That covers everything that is inside of your little black bag. And now we'll be talking about everything inside of this purple bag that we're giving you. First thing that you're going to see is this folder, and this folder has a few handouts and some more additional information on how to take care of your eyes after your PRK procedure. There is a chart in here to help keep track of all your eye drops. So the top portion here is going to be your 4 antibiotic and your 4 anti-inflammatory that you're doing today on your day of surgery. And then at the bottom half of the page, we'll begin tomorrow's eye drops. There is also a little sticker here that teaches you how to get to these instructional videos from our website. The other thing inside of the purple bag is going to be a box of your lubrication eye drops. And this is the exact box that is sold in stores. Again, these drops are over the counter. So if you run out and need to grab some more, you can take this to the store and you'll know exactly which ones to buy. So that is everything on how to take care of your eyes. I do have a few closing comments. So in terms of showering, today you can only shower from the neck down. You can go back to your normal shower routine after we've seen you at your post-op appointment. Also, there is no drinking alcohol for the first 72 hours after surgery. Alcohol dries out your entire body in general, so it will dry your eyes out. And then no sleeping with the ceiling fan on for the first 3 months after surgery, and that's to prevent your eyes from drying out while you're sleeping, since you won't be putting lubricating drops into your eyes while you're sleeping in the middle of the night. So if you have any other questions about the aftercare instructions or any concerns about your eye, please give our office a call and we would be more than happy to help answer your questions. Thank you.